Welcome, everybody. Hi, how is everybody doing today? I'm Megan, and thank you for joining me for the live free webinar from Archer Review. So today we are really talking about testing anxiety. I know a lot of us have testing anxiety. I have anxiety, period. So testing anxiety it's tenfold for me, right? So we're going to talk about some ways to conquer it, right? So first and foremost, we are going to be using some Slido today. But let me introduce myself while I'm hooking up the Slido because I want to get to know you guys. So here is the slido.com and the passcode is test anxiety or the QR code. I would love to know where you're joining us from today. Like I said, my name is Megan. I have been a nurse since 2007. My background is primarily pediatrics, doing the neonatal intensive care unit, and then went to emergency medicine. I did have done a lot of other things too, but I began teaching and I absolutely love teaching. So I really enjoy it. I am from southwestern Pennsylvania. So it is actually cooling down a little bit now. We've had a nice like hot summer, but now it's the past 2 days, it's actually been kind of chilly. You need to wear some capris. We got some Toronto, Florida, Texas, two Texases, awesome. Pennsylvania, awesome. Houston, Texas is representing today. Awesome. Well, thank you very much, Colorado. Kenya, wow, I think you got the longest distance award there, Dory. Thank you guys for joining me today. Ethiopia, another Kenya, wow, Connecticut. So I got a couple East Coasters. Philippines. I hope you're all okay over there in the Philippine area that with those you didn't get hit with any tsunamis. I was just in Hawaii a couple weeks ago and um, I got notified about all of the issues that was happening, that earthquake. All right, well, thank you guys for joining me today. I am so excited for you all to be here. So let's dive in, right? Okay, so let's sit the next Slido poll is does anyone here struggle with testing anxiety? And it's okay to say yes, right? It really is. Not really. Okay. So I like to think about it, even if you don't have testing anxiety, the NCLEX is a high stakes test, right? It really is. So it's okay to go in there feeling a little bit nervous. It really is. All right. All right. So can somebody tell me in their own words, what is testing anxiety? You can put it in the chat. You can talk to yourself in your room, wherever you are. What do you think testing anxiety is? What do we think? So testing anxiety to me, right, is a performance stressor. It doesn't have to be in a test. I get anxious and have performance anxiety, right? Forgetting everything that you have studied during the test. Absolutely. That goes along with this thought blocking here, right? Forgetting everything that you have thought you knew. And it is very common in nursing school and NCLEX. It really is. Feeling like that you know nothing when you've studied for hours. Absolutely. It's just that constantly performance stressor. It's that failure to fear of failure, right? So let's look at our next Slido question. What causes your test anxiety? I know what causes my anxiety. Mine's that fear of failure. If I could talk about that, failure. Letting people down, right? That's the other one that I think that I get a lot of issues with too. Not having enough content. Okay, good. Pressure, yes. Feeling unprepared, excellent. Nervous, pressure, right on the money, right? Not having enough that content, that unpreparedness, excellent, yes. See, that's the big one here, Anonymous, letting yourself and family down, confidence levels. And that's what we need to combat, right? We really need to combat that stuff. Really thinking it through. All right. So, the best way to combat testing anxiety is to prevent it, right? We need to prevent it as much as we possibly can. So, how do we do that, right? First and foremost is you need to realize what your signs and symptoms of testing anxiety are. Okay, so it can be any one of these over here: inability to concentrate, GI symptoms, anger, headaches, fear, feeling faint, anything like that. But you need to know what your triggers are. I know that the second that I start having palpitations and an increased heart rate, and then I start breathing a little bit faster, I get that tachypnea. I know I need to start doing something right then and there, or it's going to be bad. So really trying to realize when those signs and symptoms are. And you can actually do that as you're doing your practice questions, readiness exams, Q or CAT exams, anything like that. Anytime that you start reading a question and you start like feeling your symptoms, you're like, and it could be because you don't know the content, that you don't feel 100% confident about that content. It's okay. But we need to just kind of figure it out so you can realize your early signs so we can nick it in the butt early on, right? So the biggest thing is prevention is key, right? So some of you I think said that not knowing the content, confidence levels, those kinds of things. So having that adequate studying and review is going to help prevent that as much as possible and working on that confidence level. We are our biggest cheerleaders. We really are, okay? So when we go into that test, we need to go into that test saying, I got this and I'm going to rock this, right? I can do this. I am going to succeed. I am going to be a nurse, right? So we have to start thinking about that now. We can't just wait till the day of our test to do it because that confidence level needs to build up and it needs to be at its best when you go to test, right? The other thing too is actually understanding how the process of the actual texting will happen. The things that you need to be prepared for, like having your photo ID available. I like to joke, as trivial as this is, like the night before your test, having your clothes set out and having your keys available. I know that the second that I lose my keys and can't find them in the morning, my anxiety level shoots up, right? So having that and having to be able to be prepared. So let's see. What are some of your earliest indicators of testing anxiety? I shared mine, so what are yours? Inability to concentrate. That's probably the number one, right? Tachycardia, that's mine too. Tachycardia. Handshaking, okay. So some tremors almost. Okay. Sweaty. Unable to sleep for days before the test. So that's a really good one because we have to think about that too. Because if we can't sleep before the test, we're not resting our brain. Sleep is when our brain heals and it transitions all of our short term into memories into long term memories. And we really need that when we're studying so we can be able to recall that information. Headaches, time. Excellent. Fear, inability to concentrate. Excellent. Yeah. And those are the biggest ones. Good. Okay. So the biggest thing to combat your testing anxiety is when you start realizing those symptoms, that those signs that we just talked about, don't push through it. Pushing through it can actually add to that anxiety. So we want to actually pause and kind of get yourself to reset. And we're going to utilize a toolkit. And we're going to talk about some of those tools in that toolkit. So, do you push through testing anxiety or do you pause? Push through. Okay. And how does pushing through work for you? Doesn't really seem to work, does it? Right? So I like whoever put try to pause and take a breath. I like that because sometimes you need to reset yourself. Okay. All right. So let's talk about our toolkit. Right. So positive self-talk. Okay. So we're going to talk about this is our little lovely toolkit that I like to think about. Positive self-talk. Okay. But this actually begins now, right? We have to do this long before our actual testing date because, again, what did I say? We are our biggest cheerleaders. We need to push through it. Deep breathing, releasing tension, and the 3-2-1 rule. So we're going to talk about that. So positive self-talk. Who here starts saying, I'm not good enough for this test. I can't focus. I'm never going to pass this test. It's that inner monologue, right? That negative just keeps pounding you down, right? Pounding you down. So we need to actually turn that negative upside down into that positive. Okay. So, positive monologue, feeling good about yourself, everything that's going on in your life, having that optimistic voice that encourages you to look at the bright side, right? Picking yourself up. So changing, if you start thinking, if you're thinking you're having those thoughts over here on this red side that people don't like me, I won't ever be able to do this, so I'm just going to give up. I'm not good enough. You need to flip it around and go to that right green side. Oops, I made a mistake. It's okay. We're human. We all make mistakes, right? This is a challenging, but I'll keep doing my best. I haven't figured this out. Key word there, yet, right? I am worthy of my goals. Sometimes I also like to think about, when you do your positive self-talk, you need to really stop judging yourself and doubting yourself and really kind of check yourself to say, okay, you know what? I can do this because our anxiety kind of feeds off of that inner dialogue, right? So we have to really, really turn ourselves around. The next little toolkit we're going to talk about is deep breathing. This is my absolutely positively favorite thing to do. I do this all the time. Okay. So there's many different ways that you can do it. Okay. So mindful breathing is really being able to pay attention to your breathing rhythm, like, focusing yourself. So really when you're starting to have those symptoms deep in, you don't have to get up and leave the room. Sometimes you may have to, but all you have to do is kind of sit back in your chair, let your shoulders roll back, close your eyes, and just take a deep breath. Having that mindfulness of the actual rhythm that you are here having, especially if you are tachycardic or tachypnic like I am, me having that mindful breathing is actually going to start. I can hear it calming down and slowing down. Um, we can do, when you're doing this, starting off with those deep breathing, you want to make sure that you're using deep enough breaths that you're putting pressure on that vagus nerve because that's actually going to put pressure and decrease that fight or flight. I always combine my mindful breathing with my visualization. Okay. So as I am breathing, I go to my happy place. My happy place happens to be the beach. So I can hear the waves crashing. I can feel the sand between my toes. And as my deep breathing and my mindful breathing is calming me down, the visualization is actually going to ground me. Then you can do the counting your breaths, almost like box breathing. This is our CNO Morgan's favorite, where you breathe in, counting to 4 very slowly, feeling the air into your lungs. You hold that breath for 4 seconds, then you slowly exhale for 4 seconds, and then you kind of repeat it, right? Until you feel recentered. You can do belly breathing, where you're actually filling up and emptying your belly and using those muscles. The other one that is a nice toolkit is the releasing tension. With this one, where you tense every muscle in your body, you hold it for like 3 to 5 seconds, and then you slowly release it, like having that anxiety and tension release. You repeat that several times. There's another one you can do also. It's called progressive releasing tension, where you kind of go head to toe, but sometimes that takes a little bit longer. Then there is the 3-2-1 rule. So the 3-2-1 rule is kind of where you are focusing on things. So it's noticing 3 things that you can see, noticing 2 things that you can hear, and 1 thing that you can touch or smell. Okay. So really kind of that's that 3, 2, 1 rule. Okay, so tell me, what are some other strategies that you guys have used to decrease your testing anxiety? Meditation, excellent choice. Yep. Visualization, excellent. Listening to music and exercising, that's a good one too. That's one that you can do as you're leaving, but I want you to try to also think of some ways when you're in the test, what can you do? Because you can't leave to go exercise. I mean, you guess you could go do some running mans in the hallway, drinking water. Oh, breading. That's a good one, a nice hobby. Okay, excellent. Thanks, guys, for sharing. I really appreciate that. All right, so some daily habits. Daily habits is going to help decrease that anxiety altogether, right? So some daily habits that you might want to consider are moving, right? Just moving your body. Get up and move around. That's like that. Our friend in there that said that they exercise, moving that body. Journaling. Journaling helps too because it kind of helps channel your thoughts into tangible thoughts or items. Meditations, longer meditations. And everyone thinks that this one's funny, but the socialization and socializing actually increases our dopamine levels, it increases our happiness. So we need to do that. So those are things that we can do. They have been really proven to effectively reduce anxiety, and really a long-term strategy for limiting anxiety is including identifying your triggers, which we already talked about, getting some therapy, which I know. And sometimes these strategies including medication regimens for short term, but you can do some therapy to help dig into that work, right? If you're feeling that you have a more generalized anxiety, go talk to your healthcare provider, right? They have tools to help you also. So, what are some strategies specifically for NCLEX, right? So, research has shown that you should really keep each time frame to no longer than 2 minutes per question. Because really, if the in 2 minutes, if the answer doesn't come to you, you just need to give it your best guess and move on. Okay. Now, sometimes you're not even going to come close to that time frame on certain questions, and sometimes you are. We just have to kind of balance those out, right? Don't change your answer. Trusting your gut is really, really going to help. You do know this information, guys. You need to realize that you know this information. That's that confidence level we're going to beat up there. You studied this in nursing school, you studied and prepared constantly for the NCLEX, you know the information. So if you are drawn to an answer, go with that gut and don't change it, right? The only time that you should ever change your answer is if you are 100% confident that you misread a word and that answer choice is wrong, okay? You never want to self-evaluate on your exam. You don't want to count all your select all apply questions. You don't want to count how many case studies you've had because that's going to cause just distraction and increased anxiety. What you need to do is make sure that you are giving 100% of your concentration to the current question you have on your screen. And really ask yourself what the question is really asking you, right? What is this question really asking me? So, which method do you want to try? After talking about things today, what are you going to try? Gonna try anything? 3, 2, 1. Excellent. Okay. I like that. Don't self-evaluating during the exam. And again, practice these things as you are doing practice questions and readiness assessments and CAT exams. Practice those. Mindful breathing. Love it. Deep breathing. Don't change your answer. Go with that gut of yours. Go with that gut of yours. Because really, when you're answering the questions, you shouldn't be choosing an answer choice until you have read each answer. Deep breathing. Excellent. I love it, guys. Look, guys, you got a webinar exclusive today. Use the code I love Archer for 10% off. All right. Preparing for everything is what something you can do, right? So, like I said, like we kind of talked about, knowing where your keys are, having your outfit out, knowing where you have to park, knowing where you actually have to go to the test, that's going to help to try to minimize that testing anxiety. Avoiding that perfectionist trap. We are not perfect. We are all human, right? But just practice makes perfect. Trying to figure out where you have to go. Maybe you have to take a test run, then take a test run, right? The day before your exam. This is really, really important, okay? The day before your exam. Skim your notes if you have to. Only if you have to, right? Focus on those sticky areas, right? Notes away by mid-afternoon, mid-afternoon. Absolutely, positively no practice questions. You need your brain to be working at its best the next day. So no practice questions. And really, you need to be doing something for you. Resting that brain of yours, doing something fun that you love to do. So sitting there and maybe you want to go shopping, go get your nails done, go get your hair done, go to the spa, go exercise, go fishing, whatever you love to do, go do it because you want to make sure that you are relaxed as much as you possibly can. The other part of that is sleep, right? You should try to get enough sleep. Sleep is very, like I said, key to reducing anxiety. It's when our brain is healing. Um, you want to make sure that you are trying to sleep the night before your exam. Is it going to be the best night's sleep ever? Probably not, but you need to get as much rest as you possibly can. Do not, under any circumstances, stay up all night studying. Cramming is not going to help. Research has shown that cramming does not work. So don't do it. You want to try to get as much as you possibly rest you can. If you don't know it the night before, you're not going to know it. And that's whenever you have to say that okay to myself. It's okay not to know everything, right? Just give it your best guess and move on, right? Put your notes away, sleep, do something perfect. It's important. You don't have to know it all. We don't know it all. I don't know it all. I know my colleagues at Archer don't know it all. We learn something new every day. So you don't have to know it all, right? Well, the NCLEX is a comprehensive exam. It's meant to look at your readiness as an entry level nurse, right? Entry level. When I was entry level, I didn't know anything, right? So keep that in mind when you're doing this assessment, okay? The reality of the testing anxiety, especially when it comes to NCLEX, is you often feel pressure from others and yourselves to be perfect. Guess what? That's going to add to our stress. It's going to be harder to recall that information that you spent months, years learning. So today, I want you to ensure that we shift that perspective, that we do not have to be perfect. We don't have to be perfect, guys. We're human, right? I don't never met anyone that has gotten a perfect 100% on their NCLEX. You don't have to know it all. So what are some key takeaways from today, right? As we come to the close of our session, right? I'm hoping that you gain some insight on how to manage that testing anxiety, but let's kind of reflect on some key takeaways from our session today. I want you to be able to carry the knowledge that you have learned forward to become prepared for your NCLEX. So remember, firstly, feeling anxious about NCLEX is normal. It is a high stakes exam, right? It's normal. It's a reflection on your commitment and passion for stepping into the profession of nursing. You want to be a nurse, right? So having that anxiety, that little stressfulness is okay. But it's crucial to channel that anxiety positively, turning it into a driving force instead of that thought blocking and stumbling block. Okay? We are here. Archer Review is here to help you understand the pressures and challenges of preparing you. And our resources are here for your success, whether it's comprehensive review courses, practice exams, right? Our practice questions that really mimic the NCLEX on formatting, especially those next gen questions, or strategies to conquer testing anxiety. We are committed to supporting you in every step of the way. So, as you move forward, carry with you the knowledge that you have the entire community rooting for your success. I'm rooting for you. We all are. We are here for you guys. So we want to see you succeed. Let go of the notion that all you need to know at all, because you don't, right? Focus on your strengths, improve on your weaknesses, and remember that every step is a step closer to your goal. You really truly have chosen a passion that is all about overcoming challenges and constant change, right? To help others. Now, it's time to apply that same courage and determination into this next chapter of your journey. With the right mindset, preparation, and support, there's nothing that you can't tackle. And that's something that you need to own, right? You need to own that you are giving it your best. Archer Review is excited to be part of that journey and see where it takes you. I really thank you for spending time with us today. You're on the path to greatness, really, you are, and we can't wait to see everything that you can achieve, right? As I always say, you've got this and you're going to make an amazing nurse. So let's strive to do it. Do everything that you can to strive to do it. So we have our short pass combos and we do have our tutoring, private and small group. So, what questions do you have for me? Did you learn something new today? Good. I like it. I like yes. Okay. Any questions for me? I see someone raise their hand, so if you can come put it either in the Slido or in the chat for a question. If you have a question, that'd be perfect. Thank you. Yes, you can use these techniques on exam days. So I like to think that anytime that we're giving you guys suggestions on toolkits, strategies, could be test taking strategies, ways to decrease our anxiety, it is perfect to do a trial and error to figure out which ones work best for you. So do it, start practicing these techniques prior to your testing date so you know exactly what's going to work best for you on exam day. So, but absolutely. Oh, you're welcome. Is it better to pause or push? Good question. So first of all, I'm going to say this, that is, it's 100% a internal determination. But if you don't take at least a second to do a quick pause and kind of recheck everything, you could be pushing through it and just adding more fuel to the fire, so to speak, right? So if you don't take at least a couple seconds just to kind of be like, okay, just stop for a second and kind of recollect your thoughts, you could be setting yourself up for failure. But again, that's another one of those things that trial and error. But I always recommend pausing at least for a short amount of time. Even if it's just seriously just sitting there and sitting at your computer and be like, okay, just closing your eyes for a second, you're still pausing and just not pushing through that. All right, guys. So we have a quick survey. We are always trying to improve everything that we do here at Archer. So there's just a quick survey. If you wouldn't mind filling it out, I would love it. I'm going to put the link. There's a QR here. If you could do that. There is a link if you could click on it. I don't know if you can. I don't know if it'll let you. You know what? That how many months can you study for a test? You know, it is 100% up to you and how you feel prepared. I always recommend as long as you feel prepared to going into your test, then that's as best as we can possibly do. There is such a thing as overstudying, but you need to be able to, that's an internal thing that you need to feel prepared for it. I always recommend at least a 6-week plan after study plan after if you're a repeat test taker, because at least that covers that 45 days that you're waiting for your ATT again. All right, so here at Archer, we do everything across the lifespan. We're more than just tech prep. We're dedicated team of knowledge and navigators committed to success for future nurses. Trust us to guide you and support you every step of the way. I thank you very much, guys, for joining me. I am going to put this QR code or the survey link in the chat. So if you guys don't take mind taking just a couple seconds, it's very quick, just to fill out that survey for me, just to see what we can do to better guide you in your journeys. I thank you very much for joining me this morning. I was going to say afternoon, but it's not afternoon yet. This morning, and I thank you and good luck and best of luck with your studying. All right, I will fix that survey link right now. Thank you for letting me know. All right, we'll fix the survey link. Thanks, guys.